performing airway sanctioning. So before the procedure, let's provide client privacy first by closing the door or drawing the curtains. Next is let's identify the patient's identity using two identifiers. So, good morning, ma'am. I am Giselle Esteban, your student nurse for today. May I know your name, ma'am? Can you state your name and your birthday? Then next is, let's perform hand hygiene and apply a clean glove and assess for signs of upper and lower airway obstruction. So, apply a clean gloves. Then now I am done. Number 3 is let's assess vital signs and symptoms associated with hypoxia and hyperkalemia. Next is number 4 is let's assess for risk factors of for upper or lower airway obstruction. Number 5 is let's identify the patients with increased risk of ineffective airway clearance. So, check. Then, next is number 6. Let's assess for excessive secretions or coughing and secretions visible in airway and signs of respiratory distress and other signs for need of sanctioning. So, next is number 7 is let's assess patency of ET with capronography or EID tidal carbon dioxide detector. And then number 8 is let's assess factors that may affect the volume and consistency of secretions, including fluid balance, lack of humidity, and infections. And then next is number 9 is let's assess the patient's peak inspiratory pressure or tidal volume for endotracheal sanctioning. And number 10 is let's identify contraindications of nasotracheal sanctioning, and let's number 11 is let's review the sputum microbiology data in laboratory report. Then number 12 is let's determine presence of signs of hypoxia or hypercapnia. And 13 is let's assess the patient's understanding of the procedure and presence of any apprehensions. And now, let's proceed to the planning. So, first is, let's identify the expected outcomes. And next is, let's assist the patients to appropriate position. And then next is, let's position pulse oximeter on patient's finger and took reading and left oximeter in place. So, let's place a pulse oximeter in place. And then next is, let's explain how the procedure would clear the airway and relieve breathing, and explain that temporary coughing, sneezing, gargling, or shortness of breath was normal. So, ma'am, this procedure is to clear your airway, and coughing or any secretions or gargling, shortness of breath is normal. Then next is, let's proceed to the implementation. So, for the first step, let's perform hand hygiene, done, and let's apply a PPE if necessary, so done. Next is, let's adjust the bed for to appropriate height and lowered side rails and nearest size self, and let's check lock on bed width to prevent moving. So, adjust the bed. Okay, proper height. And then next is, let's connect one end of the tubing to suction machine and place other end near patient turn device on. And let's set suctioning pressure as lower as possible, and let's exclude end of tubing to check pressure. So first is let's open the suction tube, suction machine, and then next is let's connect the tube. And then next is let's prepare suction catheter. So let's open the suction kit or catheter using aseptic technique, and let's place drape across the patient's chest. . 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120 is on bedside table and did not allow the sample catheter to touch any non-sterile surface. And then next is, let's open the sterile basin and place on bedside table and did not touch inside of the basin and filled properly with sterile saline solution or water. So let's pour saline water. Okay. And then next is, letter C is let's open the pack of water-soluble lubricant if necessary and apply to catheter. And then next is let's apply sterile gloves properly. And then next, let's pick up suction catheter with a dominant head and pick up a connection tubing with non-dominant head. So secured catheter or two tubing. And then next is let's place the catheter tip in sterile basin suction and small amount of saline by occluding suction vent. And next is suction airway. So let's perform nasopharyngeal and nasotracheal suctioning. So let's increase oxygen flow rate for face mask as ordered or had patient breathe deeply. So can you breathe deeply, ma'am? Okay. And then next is let's coat the distal end of the catheter with lubricant. And then next is let's remove the oxygen delivery device if applicable and let's insert catheter into the nose without applying suction instructed patient to deep breath. And then next is for nasopharyngeal suctioning, let's insert the catheter properly through the nares and advance to back for pharynx did not force. And let's perform intermittent suction with raw catheter while rotating in between fingers. And then next is for nasotracheal suctioning, let's advance catheter properly through nares and into trachea. Let's insert the catheter when patient take deep breath and pull back when patient begin to cough. And had patient turn his head or her head in is needed. And let's apply the intermittent suctioning with raw catheter while rotating it between fingers. So, can you breathe deeply, ma? Suction, okay. Okay. Then next is, let's reapply the oxygen delivery device. Encourage the patient to breathe deep if able. So, can you breathe deeply, ma'am? Then, okay. Okay. Then next is, let's rinse the catheter and connecting tube with normal saline or water until cleared. Suction. And then next is, after that, let's disconnect and off the suction and place it in a clean area. And next is let's assess to repeat procedure did not perform more than 2 passes with the catheter and allow patient to rest at 1 minute and ask patient to deep breath and cough. So ma'am, can you breathe deep and cough? Okay. And then next is let's perform artificial airway suctioning. So pre-oxygenate the patient appropriately before suctioning. So pre-oxygenate. And then next, let's open a swivel adapter or remove a delivery device if patient was receiving a mechanical ventilator. And next is, let's advise patient to suction. Suctioning will begin insert catheter without applying suction until resistance was met or patient cough pulled back. And lastly, or next is, let's apply the intermittent suction by placing thumb over vent and drawing catheter while rotating it between thumb and 4 fingers. And let's encourage the patient to cough. Watch for respiratory distress. Next is let's close the swivel adapter or place oxygen delivery device if patient was receiving mechanical ventilator and hyperoxygenate the patient properly. And then let's rinse the catheter and connective tube rubbing with normal saline until clear and use continuous secretions. And then next is let's assess the patient vital signs and cardiopulmonary status and ventilatory measures for secretions, clearance, repeated step to clear secretions, and allowed adequate time between passes. And then next is let's perform oropharyngeal sanctioning after pharynx and tracheal are cleared. So, oropharyngeal sanctioning, sanction. And then next is let's disconnect the catheter from the tubing and rolled catheter in finger. Disconnect off. And then roll the catheter in finger, and let's pull glove off inside out. So the catheter remain in gloves, and pull off catheter. So catheter remain in glove, and let's pull off other gloves over first in same way. So let's discard appropriately and turn off the sanction device. Turn off, discard and turn off. And then next is let's remove the towel, place in appropriate receptacles, and position the patient. And let's apply clean gloves to continue personal care. Let's remove. And then next is position the patient and apply a clean gloves. And then next is let's readjust oxygen to original level if indicated. So original level oxygen. And then next is let's discard remainder of saline appropriately and discard the basin appropriate or rinse and place in a soiled utility room. So let's place. And then next is let's remove PPE and discard and then perform hand hygiene and place an open suction kit on suction table or at the head of bed. And let's assist the patient to comfortable position provided oral hygiene as needed. So let's remove the gloves. So next is for our evaluation, let's compare the patient's vital signs, cardiopulmonary assessment, and ETCO2 and SpO2 values before and after sanctioning. And let's compare SiO2 and tidal volumes with on ventilator. Check the chart. Okay. And then next is let's ask the patient if breathing was easier and if congestion had decreased. So, ma'am, could you give me a thumbs up if the breathing is more easier? Okay, thumbs up. And then next is let's ask patient if breathing was easier. So, after that, let's auscultate the lungs and compare patient respiratory assessment before and after sanctioning. And then next is let's observe characters of airway secretions. And then next is let's ask the patient to explain why suctioning is required. So ask the patient to explain why suctioning is required. So ma'am, why suctioning is required to you? Okay, very good, to remove secretions. Very good, ma'am. So next is let's identify unexpected outcomes. And lastly, for recording and reporting, let's record the amount, consistency, color, odor of secretions, size of catheter, route of suctioning, and patient response in appropriate log. So let's record in the chart. And then next is let's record need for and type of hyperoxygenation and percent of oxygen use. So percent of oxygen use. And then next is let's record patients and caregivers understanding, and let's document vital signs pre-suction or before and post-suction, after suction, and cardiopulmonary status and ventilation measured in the appropriate log. And last is let's report patient intolerance or unexpected changes to healthcare providers.